Coronavirus The Rundown. I'm Chris Stewart. Each day, we bring you the stories of American communities taking on COVID-19. We start with a breakdown of today's headlines. Leaders looking to the future. The CDC warns we could see a second, more deadly wave of coronavirus this winter. Its director, Dr. Robert Redfield, says that's because of the overlap with flu season. The same thing happened with H1N1 in 2009. Dr. Redfield says states should expand testing and contact tracing immediately. More uncertainty about meat prices. Tyson is closing another pork processing plant, this one in Waterloo, Iowa, because so many workers have coronavirus. The closure will impact hundreds of independent farmers who sell pork to Tyson. More than a dozen meat processing and packing plants have closed, sparking concern about supply and costs. Conflicting ideas about whether to pass another relief bill.
For anyone who thinks this is the last train out of the station, that is not even close to the case.
Democrats want another bill to help those in need, provide hazard pay to more essential workers, and to fund election security and the post office. Money could also go to state and local governments. The Senate Majority Leader says he's worried about the deficit.
I think it's also time to begin to think about the amount of debt that we're adding to our country and the future impact of that.
Now, a new $484 million bill likely means more help for small businesses. Money will go to the Paycheck Protection Program. It grants small businesses emergency loans to pay employees. The program ran out of money quickly after it was started. Leaders say the new bill will make sure that small businesses are not competing against big ones for the same money. The bill also has billions of dollars for hospitals and will pay to expand testing. Businesses expecting payments from special insurance policies say their claims are being denied. Alicia Nieves found out why.
Many of us did not see a pandemic coming. Just think back 5 or 6 months ago when we were worried about holiday gifts and gatherings. We would have never predicted then a virus with unprecedented health implications, one that would cause a shutdown of the U.S. economy, a shutdown of so many U.S. businesses in a way never seen before.
It brought my business to a screeching halt.
Ted Challenger is the owner of several nightclubs in Boise, Idaho.
We're just in survival mode and struggle right now.
Like many savvy small business owners, Challenger actually planned for the unexpected. In addition to all his required business insurance, Challenger for decades has been paying for additional coverage called business interruption insurance. He thought that would be his business's lifeline.
The insurance company they outright denied my claims.
His insurance company cited this one line in the policy that states exclusion of loss due to virus or bacteria. Across the country, other insurance companies are using this line to deny claims for thousands of businesses. And policies that don't have that wording, insurers are saying they simply did not underwrite for this kind of claim and can't pay it out.
I am in high hopes of our elected officials will see a problem here and do something about it.
Organizations like the Insurance Information Institute have come out saying if insurers nationwide had to pay business interruption policy claims for which insurers collected no premium, it could cost the industry each month anywhere from $150 billion to $380 billion. But several states believe the industry can afford this and have introduced legislation to force companies to pay out for the policy, identifying that, quote, the industry's policyholders' surplus stood at $812 billion as of September 30th, 2019. Challenger is hoping, even depending on these bills passing.
From what I understood, after 9/11, there was a terrorism clause written into the insurance, and that Congress passed a bill that they did have to pay out on it to the businesses hurt during 9/11. So I very much hope that. I wish I had more time to spend on it, but we're just in survival mode and struggle right now. And it doesn't really afford us time to go chasing legislatures and lobbyists.
In addition to not having their claims paid, so many small businesses are still having to pay into their insurance policy or risk losing that policy and thus their business licenses. I'm Alicia Nieves reporting.
Alicia, thank you. Now, the government says farmers will soon get aid. Farmers have had to destroy crops and products, some of them losing tens of thousands of dollars a month. Now, under the USDA's $19 billion relief plan, farmers, ranchers, and producers would get $16 billion in direct payments.
We don't really want a handout at all, but right now we just want to fight to see another day.
The other $3 billion would buy food for food banks and other faith-based organizations. As doctors work to find out more about coronavirus, the CDC is warning shoes can be a carrier. CDC researchers tested shoes that belonged to doctors who worked in an ICU in China, and half of the samples tested positive for coronavirus. The CDC now says anyone who steps into a hospital ward with coronavirus patients should disinfect their shoes. Researchers in Arizona had already looked into whether shoes can spread diseases before this pandemic began. Their research showed that shoes, yes, they can pick up germs and bacteria, but they can also leave them behind.
And everywhere they're walking for the next 20 steps, they're leaving all these bacteria and viruses they picked up on the bottom of their shoes. So shoes make germs very germ mobile if you have it.
Viruses that we pick up on our shoes can survive from a few hours to a few weeks, depending on the surface.
But most viruses that cause respiratory infections, the common cold, they only survive maybe from a few hours to maybe 2 days.
Our expert says these germs and viruses are harder to get off porous surfaces, and they don't come off very easily from the bottom of our shoes. Now, pandemic or not, he says you should take your shoes off when you go inside, and you could also disinfect the bottom of your shoes, and if you can, throw them into the washing machine. People and organizations are doing what they can to get on track towards some sort of normalcy, and our partners at Newsy asked a homeless shelter about the path forward.
So my name is Kathy Alderman. I'm the Vice President of Communication and Public Policy for the Colorado Coalition for the Homeless here in the Denver area. I think what the coronavirus outbreak really has shown us is that public health issues that people who are housed can address by going home cannot be addressed by people who don't have a home. And so we really need to invest in making sure that everybody has a safe place to call home and that we have more affordable housing available for people. I've been working with the Colorado Coalition for the Homeless for 4 years now, and one of our number one priorities is to find additional resources and to make all levels of government invest in the creation of more affordable housing options for people. We need to make sure that individuals and families that are experiencing homelessness and at risk of becoming homeless have safe places to go. When you start talking about addressing homelessness, both here in Colorado as well as across the country, it is a crisis. So we have a crisis within a crisis. I do have some fears about kind of crisis fatigue and people accepting homelessness as inevitable, which is totally unacceptable to me. So I think that if we look to see what we're able to do when we respond to a crisis in the short term and use some of those same goals and same objectives for long-term resolution, that we'll be better off after the crisis is over. I think that the path forward is that the community can come together and provide long-term and short-term solutions for people experiencing homelessness in a way that's not just a crisis response, but is sustainable.
And protesters around the country are calling for an end to stay-at-home guidelines. A psychologist explains what else could be motivating these protests, and volunteer nurses going into the hardest hit areas to treat patients.
Exhausting and eye-opening, shocking.
Why that nurse says she felt compelled to help.
Keller and Keller, right now.
People are protesting coronavirus-related restrictions, saying some of them are unconstitutional. Kai Beach spoke to an expert who thinks there's more at play.
Protesters looking to reopen the economy by shutting down stay-at-home orders.
I think we need to band together as Americans and ask that our voice be heard. And this is the only way we can do it, and it's our right to do it.
Across the country, protesters are taking to the streets with cars circling state capitals, calling mandatory quarantine measures too extreme.
We need to bring awareness to the fact that there are more people hurting than the people that are infected right now with COVID that have symptoms.
In these times of uncertainty, mental health experts say more people are under a lot of stress.
Anxiety, the fear, the uncertainty.
Dr. Anna Rope is a psychology professor at Metropolitan State University of Denver. She says with groups like these defying government guidelines,
they have nothing to say.
There's a variety of motivations for protesting during a pandemic. Some are invested in the message, while others get caught up in the chaos and need a group to identify with.
Thinking in terms of we instead of in terms of I can be very powerful. We're not doing well individually. Our groups can give us a little bit of a bump to say, oh, well, this is the group we're a part of, and we're great.
For us to be, labeled, oh, you're a group thinker, that makes no sense at all.
Some protesters say they're committed to their cause, calling stay-at-home orders unconstitutional. While others see different groups spotted by different values, all having hard times expressing their emotions.
We're scared of having conversations. We're scared of talking about stuff.
Despite the differences, experts say we're all in this together, and that conversations need to happen, and that all sides need to be heard.
It has to have a place to come out. And if you don't give it a place to come out, it's going to come out in an uncontrolled fashion.
I'm Kai Beach reporting.
All right, Kai, thank you. Now, breweries are adapting to what could become the new normal.
Do we want to go down this road? When this is all over, can we come back from this? Do we want to continue canning? What's our business plan look like?
Matthew Utter is co-founder of High Grain Brewing in Cincinnati. He says he and his business partners really grappled with whether to mount an aggressive to-go beer operation when everything changed. Now, his brewery is fairly new. He says that canning wasn't really part of the business plan just yet. And he says, though, the beer, it is selling really well, and it seems like they made the right decision so far. Brave healthcare workers on the front lines right now are inspiring a new generation. Sean Toll spoke to an aspiring nurse.
Healthcare workers are working tirelessly to help those afflicted by the COVID-19 virus. And the signs of appreciation are everywhere, but they're also inspiring the youth.
I think that they are really brave and they are doing something that not everyone can do.
Veronica Palmer is a sophomore at Destination Careers Academy.
I am in our healthcare career pathway studying to become a nurse.
She's wanted to be a nurse for a while, but all of this shows her why.
It's just making me stronger in what I want to do, really. Seeing all these nurses kind of putting their lives on the line and working these really long hours, it just kind of makes me excited to go into nursing.
She still needs to go to nursing school after high school, but she's learned a lot on her path so far, including basic intubation, something essential as part of the battle against COVID. But just a small part of the job nurses do.
They help keep us safe and that they basically take care of us. And so I think it highlights the need.
The need for more heroes doing their job to help and show why students like Veronica want to be like them.
Huge inspiration to me. I love seeing everyone out there helping, and it just makes me excited to go in and.
Well, Sean, thank you. Now, several states are asking for volunteer doctors and nurses. One nurse says her experience has been eye-opening. Jacqueline Schell is from Ohio, and she's volunteered to work in a New Jersey hospital, committing to more than a dozen weeks.
I feel compelled to stay because I see what the staff is going through, and I see how great the need is. The workload for these healthcare workers just seemingly impossible. I don't know how they've been doing it thus far, and so it's just amazing to see them in action and being able to take good quality care of these patients.
She says she has never seen anything like what she is seeing right now. There have been tens of thousands of nurses who have volunteered to work in the Northeast. A pair of newborn twins is doing well today. Their parents tested positive for coronavirus. We told you about the mom in Colorado who had to give birth prematurely after testing positive. The parents were only able to see their babies via video after they were born. Now, thankfully, mom is doing better and has been released from the hospital. The twins are also home now. They are on oxygen for the time being, but other than that, they are in good health. Well, this week marks 50 years of Earth Day. How coronavirus has impacted the environment and what it could mean for the future. Next.
Working for you.
Welcome back. As we celebrate Earth Day this week, coronavirus is having a big impact on the environment. Maya Rodriguez asks if the effects will be permanent.
In a world seemingly on lockdown, the Earth may be breathing easier for the moment.
So these lockdown measures are having an impact.
Susan Annenberg is a professor of environmental and global health at George Washington University. She says with vehicle traffic down by at least 50% because of the coronavirus restrictions, it's making a difference in the world's air quality.
The fewer cars we have on the road, commuting, the less air pollution and the less greenhouse gas emissions we'll have.
That can make a big difference for everyone, but especially those with underlying conditions like asthma, which makes them more susceptible to the coronavirus. A sigh of relief for some in Phoenix, where poor air quality is common.
Sometimes I've had to rush to the hospital about 3 times a day, scared because my daughter couldn't breathe. We have a lot of air pollution in this area.
Scientists are observing other environmental changes as well during this lockdown, including the fact that with more people staying put, the Earth is simply more still. Seismologists say that's leading to fewer ground vibrations detected around the world. And for the world's marine life, fewer people on the beach and on the water means creatures there are getting a break, like sea turtles, able to nest in Florida without human interference.
This is going to provide a short period of time for sea turtles, manatees, and the like to really experience the beach as it once was decades ago.
But Professor Annenberg says these changes are temporary, and a pandemic is not the way to achieve long-term environmental changes. Once the lockdowns are lifted, she says things will probably go back to the way they were, and in some instances could potentially get worse.
If people somehow become afraid to ride public transportation and transition to more passenger vehicle trips, I think we actually could come out of this potentially with more air pollution. And so I think this is the time to be thinking about how to strengthen our air quality regulations and ensure that that type of rebound effect does not occur.
Yet she says it's worth reflecting on all that's changed since that first Earth Day 50 years ago. I'm Maya Rodriguez reporting.
Maya, thank you. And there's a teenager using her time to help her peers, what she is doing every week to make sure other teens know they are not alone.
Sticking together while staying apart.
Welcome back. Each day we end the rundown with stories to remind you of the good that is happening right now. And today we go to Kansas City to introduce you to a teen who's trying to help her peers cope with what's going on right now. Just so much uncertainty. Pooja Jain started a podcast and it's called Inside the Minds of Quarantines.
It was just really sad when they announced that school was closing.
Now, each week she talks to 2 teens about how they're dealing with social distancing and just the environment that we're in right now. They encourage other teens to make sure that they stay mentally healthy right now.
I have some friends and some peers, and I know people who have reached out to the 0 Reasons Why campaign who have seemed to be struggling a little bit more just because it's not normal for us. We're in isolation.
It's just a great way to keep in touch with people and make sure that they are okay during this time. 0 Reasons Why, you heard her talk about that. It's a group of teens who aim to prevent teen suicide. And that's all the time we have today for Coronavirus The Rundown. We'll see you next time. I'm Chris Stewart. Thanks for joining us.